I think as full-service family doctors to the core is what we've tried to always do, and I think that all of us feel that we're giving way better care to our patients now. I think we see that objectively as well when we do measurements on how we're caring for our patients, and when we started to really be able to track and monitor much better through there, we realized what we thought we were doing well, we maybe weren't doing as well as we could have. I always take my laptop with me when I travel. Some people say, oh, that's terrible. But you know what? With the electronic record, I'm up early. I get up at 4 every day. I can spend a half an hour on that thing and be right up to date on my patients and not burden physicians here in any way. And I can do that anywhere in the world with my electronic records. So I'm sitting in a bamboo hut on a floating raft in the middle of the River Kwai, miles from anywhere, on a generator, and I'm doing my electronic medical records to the sound of the birds at about 5 in the morning, and I'm reading my lab work, and I'm going through it. My physicians here aren't having to deal with it, although they're backing me up, and I come across a patient who, you know, needs some intervention. I'm able to communicate in a time-shifted manner with my staff. They're not even up yet. It's the opposite side of the earth. And then there's messages left for them. They're able to get the patient to come in. The patient is able to come in, see my colleagues, has all of their history at their disposal. It's a 6 months to a year of some challenges, and hopefully by listening to a lot of us who've done it, that you can minimize those challenges. At the end of the day, everybody says they'd never go back, and I think you should take that to heart, that that really is true for everyone, both from the patient care standpoint and their lifestyle. It certainly takes some time to get there. I think having a larger group to do that and centralized administrative staff to help you is a really key part of making that workable. And there's a lot of support now in the community. I thought it was very interesting because they had a experienced provider with each electronic medical record system that's qualified under PEDO, and I was doing it for my electronic medical record provider. And at the end of the day, when I looked at all of them, I still think I would have chosen the same one. But I appreciated fully that they all offer very similar attributes, different ways of looking at it, different ways of doing it. There's so much better care that we can do with electronic medical records. There is certainly evidence around the world of what electronic medical records have accomplished for other countries and other organizations that are far more advanced in doing it than we are. And I think that anybody at their start of their career is crazy to think they won't be using electronic medical records. So make the transition now when it's easier for you. And we've had physicians right at the end of their careers. We've taken physicians who are within 2 or 3 years of retirement and brought them right onto EMR, and at the end of the day, they're just, you know, loving it.